Amid the steep rise in coronavirus cases and deaths, Guyana continues to explore various avenues to access a vaccine, which, according to the Minister of Health, Dr. Frank Anthony, will be a game changer in the fight against the disease and possibly bring an end to the outbreak. As such, Guyana remains a member of the COVAX Facility Initiative, which promises equitable access to vaccines that are approved and licensed. Dr. Anthony has revealed that the first set of vaccines, which will serve 3% of the country's population, will be administered to frontline health workers. Guyanese with underlying medical conditions such as diabetes, cancer, HIV, and the elderly will form the second category to be immunized. However, many Guyanese have questioned the safety of the vaccines and have openly stated that they will not be accessing it when the health ministry begins immunization process, which is billed for early next year. The safety concerns expressed by citizens were put to the Minister of Health during a recent sit-down with this newscast.
There are right now about 9 that are in the phase 3 clinical trials. And what those clinical trials would do is to assure that this thing is safe for human use and that it's also efficacious, meaning that it would work well. So that's why we do trials. And these 9 vaccines that are currently in phase 3 trials are to assess exactly those 2 points.
Dr. Anthony added that following the trials, the vaccines will be analyzed by various regulatory bodies, including the World Health Organization, before they are approved for manufacturing. He asserted that the current protocols are stringent enough for Guyana to secure safe vaccines.
I think the process right now that you have globally would ensure that we have a very, very safe vaccine. If it's not safe, it would not be authorized for use. So I don't think we have anything to worry about.
While the country awaits a vaccine, the health minister informed that training has commenced for healthcare workers to be able to administer the vaccines carefully. He informed that the vaccine is likely to be distributed to Guyana during the first quarter of 2021. The government of Guyana has held talks with Argentina, India, Russia, and China in relation to a COVID-19 vaccine. Meanwhile, the World Health Organization has said it will conduct its own solidarity clinical trials on vaccines before they are manufactured and distributed to countries it supports. The solidarity trial aims to evaluate whether any of the drugs improve survival or reduce the need for ventilation or duration of hospital stay. Other drugs may be added based on emerging evidence. There are currently more than 100 COVID-19 vaccine candidates under development, with a number of these in the human trial phase as the race to find a vaccine for COVID-19, which has infected more than 49 million persons worldwide and claimed the lives of more than 1.2 million people. Temika Rodney reporting for the HGP Nightly News.